There was quite a lot of good news about COVID-19 recently, but some people have been pointing towards quite a scary statistic, certainly scary on the surface. And it comes in this table from Public Health England, looking at who's got the Delta variant and what's happened to them later on. And I'll just circle it. You can see it there. Look, of those who've received 2 doses of the vaccination, 224 died. In fact, actually, if you look across those who have been vaccinated, 1 or 2 doses, the majority of those deaths were people who were vaccinated, which raises a question. Are the vaccines working? What's going wrong here? Well, it's worth just bearing in mind 2 things here, because actually these numbers aren't quite as scary as they look at first. The first thing is that even though these vaccines should reduce the risk of death, they don't eliminate it. Now, these bars here show you your mortality risk, so the risk of getting the disease and dying by age group, from youngest to oldest. And you can see, obviously, the oldest, that 90-year-old group, is very high indeed. I'll just put that into a logarithmic scale so you can see the bottom end as well. And let's just kind of go through this. So 90-year-olds up there, pre-vaccination. 60-year-olds, for instance, pre-vaccination, are down there. But if we reduce those bars in line with what those pharmaceutical companies say they should be reduced by, that they go down, the risk of dying across the piece goes down. But even so, even if they're working supposedly as they should do, the risk for a 90-year-old is still in line with a 60-year-old pre-vaccination. So it's not eliminating it, but it is reducing it. Second thing is this. Just look at how many people have been vaccinated of that pool that we're talking about. So these are people who have got Delta. You can see that about 85% or so were vaccinated. So that's most of your sample pool. And then when you look at other things like hospitalisations, those blue bars, the blue bit of the bar is bigger than the red bit. But now break it down. Look at how many of those people who were vaccinated went on to hospital. It's about 3.5%. Now look at how much of the red bit, so those who are unvaccinated, were hospitalised, 8.4%. You see, there's a difference, a kind of difference in likelihood. 2.4 times more hospitalisations per case among those who are unvaccinated, and yet the sheer number of those who are hospitalised, having been vaccinated, is higher. Similar thing when we look at deaths as well. So the same thing again, we start with total number of cases, then we look at the number of deaths, and then we look at how many deaths per case. And for vaccinated people, it's 2% of those who were tested positive for Delta went on to die. For unvaccinated, it's 5.6% of those who got the disease went on to die. So a higher proportion, again, 2.8 times more deaths per case. And yet, the sheer number of those who are vaccinated who went on to die was greater than the number who were unvaccinated. Just underlines that simple numbers on their own don't tell the full story.